course, we are watching the tropics as we contend with the coronavirus pandemic. And tonight, there are more signs of escalating stress inside South Florida hospitals. Physical space is an issue, but human exhaustion is a bigger one. Right now, Miami-Dade County has nearly 2,200 COVID-19 patients being treated at hospitals, and there are nearly 1,300 patients in Broward hospitals. CBS 4's Ty Russell has more.
Tuesday's numbers show Broward hospitals are near capacity for regular and ICU beds. But Memorial Healthcare System CEO Aurelio Fernandez says doctors can always make room to save lives.
We have added beds and converted beds into what we call negative pressure rooms to care for critical care patients.
Since Thursday, the county has hovered just under 1,300 people in the hospital. The county's dashboard Tuesday shows there's less than 20% of regular beds available and less than 10% of ICU adult beds are open. And with so many patients, staffing is a concern.
But the staff has been working at this now for, 5 months? And it gets to you. The stress levels are very high. We were very fortunate to be able to recruit over 200 traveling nurses.
It's common for two hospitals with Memorial Healthcare System to care for many patients across county line who live in Miami-Dade near Broward. The latest 7-day average shows about half of the patients at Memorial Hospital Miramar live in Northwest Miami-Dade. More than 40% at Memorial Hospital West live across county line. So with the increase in patients from both counties, the CEO wants everyone to be safe.
The residents of South Florida need to abide by CDC guidelines to avoid getting contaminated with the virus.
That includes facial coverings, hand washing, along with keeping a distance from others and avoiding crowds. That's because there's still no cure, and hospital workers say you may never know how sick you'll get.
So it takes a long period of time to get them off the ventilators, and hopefully they can walk out of the institution. But you're looking at 2 to 3 weeks worth of critical care.
The main push from hospital leaders tonight is to see the rate of cases decrease here in South Florida, because then they want to see the domino effect. Right now they're saying hospital numbers level out, but they want to see those fall, because then that means fewer people in the ICU and then fewer families planning funerals. In Hollywood, I'm Ty Russell, CBS 4 News Tonight.